Good morning. Good morning. I'm Representative Mary Welander, and I have the privilege of serving as the chair of the Early Childhood Caucus, as well as the vice chair of the Children's Committee, and serving on education and the Select Committee on Special Education. Thank you to everyone here today. This is an amazing turnout. I'm so grateful to see so many people to be here for this important conversation. We are so lucky to have heard from teachers and providers, parents and advocates telling their stories, and thank you for sharing them with us throughout this whole session so far. If you've been paying attention to the bills proposed this session, you will have seen the multiple major pieces of legislation that are working to address the crisis in childcare and early education. While it can be tricky keeping track of the details, it is heartening to see the attention being paid to this issue, from House Priority Bill 5003 to the Governor's Bill to Senate Priority Bill number 1 and the many other proposals that look to make a difference in this field. They are reflecting the importance of these conversations and doing this work now. So let's talk about the real-life impacts of the lack of quality childcare and the insultingly low wages that accompany it. Women are the economic drivers of our society, but we are also the most vulnerable at times. In 2022, a study by the TIAA Institute found that women on average had 30% less saved for retirement than men. Another study by the Census Bureau found that in opposite-sex couples, the annual wage gap between men and women doubled after the birth of the first child to over $25,000. And roughly 32% of women never return to the workforce. And I know these statistics personally. I am the mother of 3 children. I stayed home because we could not afford childcare. I worked in a childcare center for very little. It was an amazing opportunity, and I'm so grateful for that chance. But I was home for 13 years because I could not get a job, and getting back into the workforce is incredibly challenging once you've been out. And on top of that, if you can't work because you can't afford or find childcare, then you aren't paying into Social Security. You are not able to contribute to a 401k. If you are working but only being paid a fraction of what can be earned in other professions, then you aren't able to save at all. Women are also living on average 7 years longer than men, meaning that our smaller savings have to stretch even further. And these statistics don't fully recognize the earning disparity that impacts women of color. If we want our economy to succeed, then we need to ensure access to a variety of quality health care and early childhood education. Early childhood education opportunities that meet the need of each community. If we want our families to succeed, then we have to address the unsustainable rising costs of health care. Of that care. If we want our communities to succeed, then we have to pay our providers a wage that reflects the importance of their roles and empower the women behind this industry. These are not challenges with easy solutions, but the success of our state and our children is at stake. The time is now.